Welcome to my channel. In this lecture we are going to discuss about the concept of orthostatic or postural hypotension. So this concept basically deals with the blood pressure of the human body. So the normal systolic pressure of the blood pressure of the human body is 120 mmHg and the normal diastolic pressure of the human body is 80 mmHg. So how does this orthostatic or postural hypotension relates to blood pressure? So what is orthostatic or postural hypotension? So if you can imagine a situation where a individual is sitting for a long time and working on his laptop, or he is lying down on his bed for a very long period of time. Take these in these both conditions, the individual is sitting or lying for a period of about 5 to 6 hours continuously. Now he wants to suddenly change his position from either sitting or lying to standing position. So now what happens when he stands up quickly after a 5 to 6 hours very long duration of time? If he stands up suddenly, what happens is he gets dizziness. So what is the reason for dizziness? So this is due to the reduction in blood pressure or heavy fall of blood pressure from the upper region of the body towards the lower region. The blood starts to flow from the upper region, from head to the toe. It will flow under the influence of gravity. It will flow heavily. In these conditions there occurs dizziness. The individual loses proper sight of what he is in front of him, so that he could not see properly for 2 to 3 minutes. Usually the result of orthostatic hypotension, there will be reduction in the systolic blood pressure of about 20 mmHg, and there will be reduction of diastolic pressure of on an average of 10 mmHg. So this dizziness will last up to 2 to 3 minutes. So what are the reasons for this dizziness? Is it common for all the individuals, all the persons? So it will affect certain individuals, such as who is suffering from dehydration, a loss of water content in the body. So if they do heavy exercise, in abdominal exercise or any exercise like a squat for a longer period of time, and suddenly if that person changes the position from sitting to standing or lying position to standing position, so he gets this problem of dizziness. So this not only affects persons who are suffering from dehydration usually, so it affects the patients, bedridden patients. For example, there are spinal cord injury patients who are who could not walk properly. They will be permanently bedridden for a longer period of time, or patients who have their limbs amputated and they are bedridden for a permanently or for a longer period of time. So what happens to this lying down in bed for a longer period of time? It creates the pressure source. The pressure source will be created. Pressure source are wounds, so to say, wounds which is created on the surface of the body which is in contact with the bed. So in order to shift the position and to avoid pressure source, mainly in hospitals there are tilted beds available. This tilted beds works on the principle of shifting the angle from 180 degree. Patient lies 180 degree flat, and by communicating, the physician will communicate with the patient, and slowly the position will be shifted from 180 degree, and by communicating with the patients about their dizziness, about their easiness while changing the position, so to say, simply to avoid the giddiness, they will slowly shift the position from 180 degree to 90 degree. So they will stay at that position for some amount of time, and then they will be allowed to lie down from 90 degree. Slowly, step by step, they will allow to go to 180 degree. So this is done. This tilted bed is there for patients in to avoid the bed source or pressure source, which will be caused by contact of the skin of the body or surface of the body in the bed for a longer period of time. So simply, orthostatic hypotension is the sudden fall in blood pressure which causes dizziness. Thank you.